order by MCI was totally based on the opinion of the lawyer, making it as an MTP at 28 weeks. Even in the court of law at NCDRC, case was mentioned as MTP. The lawyer and judges are so ignorant that the pediatrician will be never called in MTP case and they will only come to attend the delivery for the newborn, which was also done in my case. Seniors, colleagues, it really matters a lot. I remember and I still admit what
my thing went off. I just want to tell both the cases as far as Dr. Raj Bokaria is concerned. See, the question is, in Raj Bokaria's cases, both at DMC and the Medical Council of India, there was no negligence. Let me be very clear. But if a lady dies, or if she loses an organ, or if she even mentally goes haywire, you have to compensate her. एक डॉक्टर लड़की मर गई, उसको 30 साल उसको उसका अर्निंग करियर बाकी है. Court cannot let you just go. You have to compensate. आपका चाहे कोई मेडिकल नेग्लिजेंस पूरी नहीं हो, अगर कोई भी बच्चे को हैंडीकैप हो गया है, बच्चा हैंडीकैप हो गया, ये डेथ हो गई, आपको कंपनसेशन देना ही पड़ेगा. So never go with an idea that something wrong has been done. You have been well represented. You were cleared twice at Delhi Medical Council. You were cleared at the highest court, that is National Medical Council. But अगर वो पेशेंट मर गई तो आपको तो पैसे तो देने ही पड़ेंगे भाई. Everybody was listening me. आपने किसी की किडनी खराब कर दी, आपने किसी का हाथ खराब कर दिया, आपने किसी की आंख खराब कर दी, आपने किसी का कान खराब कर दिया. Compensation has to be given. You can't go without it. कोई यही प्रूव कर दे कि डॉक्टर साहब जी मैडम ने ऐसे किया और मेरा मेंटल टॉर्चर हो गया और मेरे को ये हो गया, मेरे को ये हो गया, तो भी वो कोर्ट आपको 5 लाख थमा देगा उसको.
Ma'am, in your case there was no loss of anything, but still you got the.
See, एक बात बिल्कुल, anybody who's listening, there are many people here, 20-30 people जिनके cases हैं where the child is handicapped or anybody is handicapped, आप मान के चलिए आपको पैसे तो देने ही पड़ेंगे. Raj Bokaria के केस में तो Raj Bokaria has been lucky. There are big hospitals involved. 1 crore has been there. 90% has to be paid by the big hospital, and madam has to only pay 10%. But if it happens to a small nursing home and you happen to own that particular nursing home, everything has to be paid by you. ये वाली फंडामेंटल्स बिल्कुल क्लियर है. मेरी आपसे सभी से रिक्वेस्ट है कि प्लीज मेडिको लीगल आप अपना कोर्सेज जरूर करो. जब ये आप कोर्सेज करते हो 10-12 मॉड्यूल तो आपको इतना सिखाते हैं वो लोग कि आपके सारे फंडामेंटल्स क्लियर हो जाते हैं. And every time the session will be for 1.5 hours. It is from 7:30 to 9 o'clock. And I apologize that we are not going to take a big platform. We are only going to. I am going to train only 100 people. Whoever is interested should come in time, so at least you get the entry.
Thank you, ma'am. Thank you. And we all are a part of the medical legal cell, and we have really learned a lot. Like constant drilling. कोई आपको हर हफ्ते बताएगा documentation ठीक से करो, constant forms कौन से होते हैं. Only then it gets into your head and you start actively.
I wish to ask one question. If there is a patient, she has IUD, and now you do a delivery of the patient and you call the pediatrician to check the baby. Now, should the pediatrician make file of the baby? Because sometimes we say कि file बनेगा तो बेचारे को extra cost लग जाएगी. So what should be the policy?
आपका जो केस रिकॉर्ड है उसमें बनेगा,
उसी में डाल दो.
और उसका रिकॉर्ड होना चाहिए.
हाँ, it should be
रिकॉर्ड के जाए तो मुश्किल है.
मैम एक क्वेरी है. अगर एक पेशेंट एमनियोटिक एम्बोलिज्म से मरता है, everything that is done is there, right? And this is a known complication. If a woman dies, then the doctor cannot be held responsible and cannot be made to compensate. I can't hear.
Sharda muted.
Ma'am, you are not.
आपके केस में क्या हुआ? डॉक्टर साहब क्या पॉलिसी ये है कि आपका जब भी केस होगा आपके सिविल सर्जन देखेंगे और सिविल सर्जन आपको वहां की काउंसिल में भेज देंगे। यूपी में है तो यूपी में भेज देंगे, हरियाणा है तो हरियाणा की काउंसिल में भेज देंगे, दिल्ली में तो दिल्ली मेडिकल काउंसिल में आ जाएगा। ना दिल्ली मेडिकल काउंसिल ने काम खत्म कर दिया और उन्होंने कहा कोई मेडिकल लीगल नहीं है और उसने और कोई दरवाजे नहीं खोले तो आपका केस खत्म हो गया। एम आई क्लियर? बट अगर उसने 10 दरवाजे खोल रखे हैं, डॉक्टर राज के केस में उसने कौन सा कोर्ट नहीं गया था? He went to the criminal court, he went to the national court, he went to every court, you know. आप नेशनल कोर्ट में जाओगे तो उसकी बीबी मार दी तो आपको कंपनसेट करना ही पड़ेगा मैडम।
मैम एक सेकंड, आई मे हैव मिस्ड। डॉक्टर राज आपके केस में डेथ हुई कैसे?
ओह मैडम ये वाली बात अभी इस टाइम नहीं, रिकॉर्ड की बात है।
मैम
आप प्राइवेटली में मैडम से पूछेगा।
Madam, there is one question by Dr. Harleen. She says, can we write NAD in notes? And is it medical?
NAD amounts to that you have not done anything. It's a bad thing.
Like when we write the perispeculum and vaginal examination, you write cervix, antiverted, healthy, uterus, normal size, free.
I think Dr. Leena, Dr. Shakuntala, wind up, please.
Yes.
Thank you,
Dr.
ma'am.
Shakuntala,
Anybody wants to make any comment? We still have 10 minutes.
Okay, so can I come in for a moment?
Yes, Dr. Bal.
Yes.
So I think Dr. Shadajan made a very valid point, and this is what is called as a tort, T-O-R-T in law, civil wrong. And I think it is like, it's like a accident happening on the road. It's not that the person who was driving the vehicle and has caused accident is negligently responsible for under 304A IPC, जो कि डॉक्टर्स के अगेंस्ट भी लगाया जाता है और व्हीकल ड्राइवर के अगेंस्ट भी लगाया जाता है कि उसकी कोई गलती नहीं थी। बट एज फार एज सिविल लॉ इज कंसर्न्ड और कंज्यूमर कोर्ट्स आर कंसर्न्ड, he needs to be paid amount as compensation because there has been a loss of a limb or earning or life. So for that reason, and there was a recently 3 months ago a talk in IMA East Delhi branch, and one of the learned judges, sitting judge, ऐसा बहुत rare होता है, he was presiding for a session medical legal. So I asked him this very question very straightforward, that most of the times doctors are not negligent, but still compensation is granted by the consumer court. So why does this occur? And this is what the reply he gave, that the compensation is given because there has been a loss of a life or a limb or earning, whatever. It is not necessarily that medical negligence has to be there. So what is the biggest difference? What do we learn? That as a gynecologist, if I'm practicing with anything less than 1 crore medical indemnity insurance, I have to think 20 times before sitting in my chair. Anything less than 1 crore, not advisable at all. अब आप देखिए ना, इसमें इतना पुराना केस था ऑलरो, आज की डेट में 1 करोड़ की बात कर रहे हैं। एटलीस्ट 10 lakhs देके डॉक्टर इज सेफ, 90 lakhs द कॉर्पोरेट हॉस्पिटल इज गिविंग, बट अप टू 1 करोड़ अगर उससे ज्यादा करा सकते हैं तो इट इज एडवाइजेबल। दिस इज आवर डिफेंस in the sense कि this is
I think we all should represent for a ceiling in the compensation that can be attributed to a doctor. Sometimes the court can go really crazy. 11 crores was put in Saha's case. I don't think that anybody of us can have
doctors 11 had to pay peanuts compared to that. It was ridiculous. In a matter of lakhs only. The 90% of it was given by the MRI hospital.
चले जाइए, ये तो बढ़ेगा ही, कम नहीं होने वाला।
हाँ, and we can never have a ceiling as per the laws है। Yes, we are. Yes.
हमारे लोग रिप्रेजेंट ही नहीं करते इन लोग की। एक बात मुझे ये बताइए कि जब एक फ्लाईओवर गिरता है, किसी की रिस्पॉन्सिबिलिटी होती है, उन लोगों की कंपनसेशन करोड़ों में देती है सरकार। दिस इज नॉट डन। We are stupid people. We are not.
I think we are going out of the topic. That is a different issue. We can only talk about us.
How come a death occurring by medical, in a context where there is a disease also?
Doctor, you're going away. This is not the talk of discussion, and we cannot do anything about it.
Yes,
Shakunda,
we
wind up.
agree, yes.
So we've had a very interactive and good and informative session. I think Dr. Shakuntala, are you there? She couldn't join because the house was full today. Thank you,
No,
everybody.
Shakuntala joined us.
Thank you,
Yes.
Madam Dr.
I
Shah.
think she has been able to join, but
I don't see.
डॉक्टर साहब अगर आपने है मीटिंग में तो आपको समय पे आना पड़ेगा. This I'm going to do it. I'm not going to increase the platform more than 100.
So thank you, ma'am. It was due to you that all this unity is taking place, this awareness is taking place. Really thankful to you. Thank you, everybody, for joining and for getting the pearls of knowledge. Thank you, experts. Thank you, Dr. Gaurav Agarwal, Dr. Leena, Dr. Raj Bokaria, and Dr. Sonal, Dr. Jyoti Bhaskar for sharing your personal experiences. Thank you very much, everybody. Very nice. And see you very soon
and
on the medical legal cell.
on the Kanun Ki Pathshala, our first.
Yes.
It was a great success.
It has been a
Thank you. ये बता दो कोर्स कैसे करें?
Dr. साहब ऐसा है, let me be very frank with you, is that Dr. Gitendra and Dr. Hitesh are going to come out with things. Till that time you can definitely do it because जो हम लोगों ने किया था डॉक्टर साहब सिम्बियोसिस पुणे से वो तो कुछ भी नहीं था. बिकॉज पढ़ना है तो आपने इन्हीं लोगों से पढ़ना पड़ेगा. So once that course is there, then we will let you know about it and आप उसको join कर सकते हैं.
ठीक है. Thank you, ma'am. Good night, ma'am.
DGF
Good
has
night.
closed this, because we really could not go after people, उनको ये लगता था पैसा हमारी जेब में जा रहा है. हमारी जेब में तो जा नहीं रहा डॉक्टर साहब. ठीक है.
Thank you, ma'am.
Thank you. Right, Dr. Thank you very much.
Thank you.
Thank you, ma'am.
Thank you.
Good night.
Good night.
Good night.
Thank you, ma'am.
Welcome.
Good night.
Bye, Dr. Raj.
Bye, Dr. Divya. Bye, Dr. Leena. Bye, Dr. Raj.
Bye. Bye.
A good initiation, है ना? Good
Yes.
beginning.
Bye. And I'm so happy to see you, Dr. Raj, smiling.
No,
Yeah.
it didn't affect me at all. I was
Actually,
so
since
happy.
morning,
Actually,
It is the end.
Shakuntala rang.
Dr. Raj Bokaria suffered so much in the last almost 20 years that her dedication is seen to it that she has helped hundreds and hundreds of people who have been affected by various litigations. And that's why we have such a great bonding for the people who have suffered as far as the litigations are concerned. Because they got the right advice, they got the right help, and everything has been done. It is a medical legal cell of Delhi Gynecologist Forum, which Dr. Raj Bokaria heads.
Yes, ma'am.
Should I start? At the outset, I like to thank the DGF Medical Legal Cell to give me this opportunity to share my experience in the legal journey which dates back to 2005. The brief summary of the case is a postgraduate MD obstetrician and gynecologist, Gravida 2, Para 1 with living one child, and where the previous delivery was also done by me. She was admitted for delivery at 28 weeks of the gestation after the multiple and repeated counseling session with the couple. This is with the couple, not with the patient only. She was not willing to continue the pregnancy ever since she came to know with the amniocentesis report of at 26 weeks of gestation with the report of abnormal chromosome 22 and with the fear of having a mentally retarded baby. I agreed to it looking at her condition. The preterm induction of labor was done for the reason aggravating bronchial asthma and worsening her mental and physical health due to the stress as a result of diagnosis on ultrasound having a single umbilical artery along with the abnormal chromosome 22. She got admitted with the informed consent because after the last consultation, she got admitted after 6 days. And then after 2 days of the induced labor, she delivered a gasping baby where the pediatrician came to resuscitate the newborn but failed in reviving the newborn. He was taken for MRP under anesthesia for retained placenta, but unfortunately had the Mendelssohn syndrome in OT before the anesthesia. During the vomiting, the placenta, and in spite of all the effort in a tertiary care hospital, she expired after 36 hours of this incident. It was not a death notice by the husband. The case was filed everywhere. DMC, it went twice, the MCI, the FIR was also lost. So now I think today everyone must be knowing the result. The order has been announced. Now, highlight of this case, the main allegation is the illegal MTP at 28 weeks. And I don't hesitate to accept that my case is a reflection and good example of improper, incorrect, incomplete, poor, and no documentation, as the importance of documentation has already been highlighted by ma'am. In 2005, because the happened in 2005, but the case was filed in 2005. So in that also, during the 2005, the informed consent, procedure specific consent form and consent for inducing labor was not the practice, and it was never taken. It was an implied consent as she got admitted after 6 days of the last consultation. As it was a preterm induced labor delivery, so filling up of the MTP form was not indicated and not done. There was no practice of documenting the counseling, communication done at that time on the various sessions, and there was no proof for it, because even if you have done it multiple times, it was not documented on the file. The documented words on the file admitted for termination of pregnancy on admission, which was in the medically, it was used as an analog that the pregnancy is not continued and interrupted for the delivery, and hence the case was filed using it as an illegal MTP. As we doctors are ignorant about the medical legal and maxims, same is with the lawyers and judges. They don't have either know or very well, or they don't have any knowledge about the medical subject, legal lawyer.